It helps the digestive system to recover from all the inflammation that people have from eating the wrong kinds of foods, abnormal bacteria. And so it just helps to heal that. And during the process, they just kind of naturally lose weight anyway. Because we try to change your diet. We have to obviously eat more vegetables, the right kind of protein, and water. And so just by changing your diet somewhat, and we try not to do too drastic of things with patients, but just learning to eat protein, vegetables, salads, fruit, and water. If you just eat those 5 things, you're going to lose weight and you're going to feel better.
Yeah. Well,
that's it. I mean, so it doesn't have to be complicated. It can really be simple if you just follow the 5 eating rules, and that's it.
Wow.
And you heal the digestive system so that your body can actually digest and get the nutrients from the food and assimilate it into the body, and the body can use it there. It's more efficient.
Okay.
And so by doing that, the patient will, again, normally just lose weight and also feel better. And during that process, we also stress the importance of working out. Everybody's seen The Biggest Loser, right? So everybody knows that working out and exercising is at least 50% of losing weight. So we teach them, again, just the same things that I do in rehab. We do the exercise ball. We teach patients to do those things, to do the core exercises, to work large muscle groups, and by strengthening the muscles and the ligaments, being more flexible in all of your joints, it just ends up being a very win-win situation for the patient.
Well, it's excellent to hear you do all these different things on the spectrum. Well, as we wrap up, let me ask you one very important question. What is the thing that you see the most? I know it's kind of a tough question, so let me lace it with a second question. What do you see the most people doing wrong? And even in that same question, what is one of the things you see that you do the most in your clinic? Just that you see the most, what are some procedures that you do? And, of course, maybe even what do you enjoy the most? Which I know is a tough question, but,
boy. I'm really honest. I see all kinds of. I can't say that I see most low back or most neck or most headaches or this or that. Because again, I see the whole spectrum of it. I enjoy it all.
Yeah.
I enjoy what I do. This is what I was born to do. I feel like so I'm a very blessed person in that aspect, and the fact that I can't wait to get here. I can't wait to see people, to help people, and that's what it's all about.
That is very
I do want
rare.
to mention the one thing, though, that I have started doing that has me very, very excited, and that's the allergy relief. The advanced allergy therapeutics. That is something that I have been looking into for quite a while, really. Just looking at different things out there, and there's all kinds of things out there. But I ended up using the advanced allergy therapeutics program that I have, and basically we treat allergies as an inappropriate neurophysiological response to a substance that should be harmless. And so an allergy, if something was a true allergy, then everybody would be allergic to it. Just like a poison is a poison. I don't care who you are. If you drink the poison, you're going to be poisoned. Right? But if somebody eats a strawberry and has an allergic reaction, well, not everybody that eats strawberries has an allergic reaction, right? So again, we get back to the individual body having its own set of rules, so to speak. Right? And so it's all done. I have to admit, it's kind of Star Trek stuff because we have a computer that has over, I don't know how many, but I know it's over 45,000 very specific digital representations of substances. And people go, well, digital representation, what do you mean? I said, well, think about music. Somebody plays music, it gets digitized. You put it on a disc, and you play it, and you hear the music again. So that's what happens with all these different substances, from foods to pollens to, you go on and on.
Wow.
I saw the original technology in '88, and of course they've refined it since then, and now they have it in the computer. We have a cuff that has a transmitter, so we transmit those signals to the patients, and then we can test the patient to see if they are truly allergic to whatever substance they are. Of course, some people come in and they already know, well, I'm allergic to this or that, but we go through a whole protocol, and sometimes we find things that they don't know they're allergic to.
Wow.
And so we can treat them for that, and we treat using the principles of the principles of chiropractic and traditional Chinese medicine. We treat the way we treat the patient. We expose them to the substance that they're having the reaction to, and we treat the meridians that run up and down the sides of the spine. They're called the back shoe meridians.
Mm-hmm.
They go to all the organs in the body. So by treating those when you're exposed to that substance, we can actually change the neurophysiological response from an inappropriate response, which is an allergic reaction, to an appropriate response, which is no reaction.
Well, that is absolutely fascinating. I mean, really, I would like to talk a lot longer if we could, but unfortunately we're out of time. One last question for you. If I were to go into your clinic, do you have, what do I have to do to get a visit? Is there, do you have a consultation discount?
Basically you just call and make an appointment. And, we just go through the same thing with everybody, either be chiropractic or acupuncture or allergy patients.
Okay.
Paperwork, consultation, exam.
Excellent.
And with the allergy patients, we do all the testing. With the chiropractic, we do the exam and x-rays. And with the acupuncture, she does her diagnosis, an exam.
Yeah.
And it's pretty standard throughout the whole thing.
Well, excellent. Well, listen, Dr. Vance, I greatly appreciate you allowing us to interview you. And Pam, do you have any last comments?
No.
No, it's all fascinating, and I've learned from my own situation with back pain. What you're doing is what works. That's the thing. You're not going in to a chiropractor to just get your back cracked, and you're really going in to get healed and to get treatment that's going to make it last long term.
That's the concept we take. There's many facets to back pain and many facets to health. And we try to be aware of as many as we can and listen to the patients and really kind of find out where they're coming from and what's happening with them. And then we try to address those concerns or symptoms in an appropriate way.
Excellent. Well, listen, once again, Dr. Vance, thank you very, very much. And, of course, we'll have all the information on the site so people can get a hold of you.
Thanks.
And once again, thanks for allowing us to give you to do this interview with you.
Okay, great. Thank you.
This concludes our interview with Dr. Vance, who obviously practices what he preaches. For more information on Dr. Vance or his treatment methods, please visit our site, paininmyback.com. That's pain-in-my-back.com.